All right, in 2020, England's National Health Service commissioned leading pediatrician Dr. Hilary Cass to review the gender services it provides for children and young people. Now, the final report released this week provides a devastating blow to LGBTQ ideology and those who are pushing it because of its harmful treatment of children. Now, according to the report, children have been permanently harmed by, quote, a lack of research and evidence on medical interventions, end quote. More importantly, leaders from both leading political parties in England indicate they're prepared to follow its guidance. Will that affect what we do here in the United States? Joining me now to discuss this is Dr. Jill Simons, who is the executive director of the American College of Pediatricians. Jill, welcome to Washington Watch. Thanks so much for joining us.
Thank you for having me.
So I know you've been tracking this, and we've expected the report for some time. Tell us your reaction to these findings. Are you surprised?
I'm not surprised, but it was reassuring to hear Dr. Cass say in her own words that there's significant lack of evidence in this area, and that there's evidence that what we're currently doing, or what England was doing, was causing harm to children. And some of her recommendations were very encouraging, and I hope that the United States follows.
So, Dr. Simons, give our viewers and our listeners a sense of the breadth of this review and just how non-existent, really, the foundation was or is for these protocols that are being used on minors.
This review was quite extensive. In fact, when they started doing the review, they realized that there was such a lack of evidence, and to understand fully the research and what is needed for children with gender dysphoria, they actually involved the University of York to conduct research or to evaluate the research that's out there. And so not only was it looking into what the clinics were doing, but it was doing background on what we know, what research exists out there currently.
The report, she said that the World Professional Association of Transgender Healthcare, WPATH, had been highly influential in directing international practice, although its guidelines were found by the University of York's appraisal to lack developmental rigor and transparency. So as the York looked into this, University of York looked into this, the very organization that has been driving this is doing so without any real foundation.
You're exactly right. This is what we at the American College of Pediatricians and several others have been crying out for years. The protocol that all these guidelines are based on are flawed, and they're based on these Dutch studies that were done, and they were not done on children. The data was extrapolated to children. The creators of the Dutch study have even come out and said this wasn't intended for this population. And so then other groups, like WPATH, as you mentioned, base these protocols on this, and it's faulty from the foundation.
From what they were able to gather in this review, was this area of medicine being treated differently than other areas of medicine?
Sure. That was one thing that Dr. Cass says in her opening remarks, that, you know, children deserve to have the same standards of care that every other child or every other person receives when they have they're treated for a medical problem. And this just wasn't held to that standard. And it says over and over in the report the lack of evidence, the weak evidence. And so she made it clear that these children are going to be not experimented on anymore, that they're going to be treated as they should.
So given the fact that there's basically no evidence to suggest that this is the path that we should be putting children on, in fact, the evidence would point most likely in the other direction. Is it ideology that's been driving this and not science?
Well, it fits the definition of ideology. You know, in medicine, that's we push for treating patients based on the evidence and long-term outcomes and science. And clearly there are agendas for people pushing these treatments.
So here's the big question. The UK, leaders in UK say they're going to change. They want to amend their protocols, how they're addressing this based upon this research. We have in this country, what I've seen is a reluctance, or actually barricades put up so that we can't do this type of analysis. Will this type of research that is coming from Europe have an impact on what's happening here in the United States?
It will eventually. I'm hopeful that my colleagues, especially my pediatric colleagues, will take this like we do any other medical findings and look at the facts and decide to do what's best for children. If we can't, if our profession, can't make the right decisions, then these will be settled in the courts. There's already lawsuits from children who've been harmed. The detransitioners. They've, suffered, and their families, a lot of harm in many cases. And so now finally the institutions that have done this to them, and even the AAP who and their guidelines, they have been sued in this. So if us as medical professionals, as pediatricians, don't get this straightened out, it will get settled in the courts eventually. We just want this to be resolved as quickly as possible so that no further child is harmed.
Dr. Simons, that brings up a really good point. The institutions have been so infiltrated with this ideology, and the medical institutions that in many ways determine who practices medicine, who gets slapped down and who doesn't. I don't see them doing a course correction on their own. I'm not a big fan of the courts, although I think this is one of those areas where the trial attorneys actually have a very fundamental role to play, because the evidence will speak for itself in a fair courtroom.
Right. I remain hopeful. I speak to pediatricians all the time that are not going along with the AAP or their institutions. Right now, they're afraid to speak out because they're being punished. They're losing their jobs, their livelihood. But more and more of us are speaking out, and especially the younger generation, the medical students, are speaking out about this and not putting up with it. So we're trying to support them. And I think it's going to reach a tipping point, I hope, where people just can't stand in the sidelines anymore, and enough brave people step forward.
And that's going to be key, because they are targeting the medical schools, doctors, nurses, trying to really poison their minds and scare them at the very beginning to walk in lockstep with ideology. Dr. Simons, I want to thank you for joining us today, and I want to thank you for being one of those brave, courageous doctors that are willing to step up and speak out and give others the courage to do the same.
Of course. Thank you very much.